very much, everyone, for joining us for this webinar about coping with extreme heat. My name's Laura Katawaki, and I'm a Research and Knowledge Mobilization Specialist with United Way BC. Today, we're very excited for this webinar. I think we all know, of course, that it's starting to heat up and we're getting some of that nice, warmer summer weather. But with that also comes some dangers in terms of extreme heat and its impacts on many people, but especially older adults. So we're going to be learning more about some of the recent research around coping with extreme heat. Before we get started with the webinar, I did want to do a land acknowledgement. So United Way acknowledges the homelands of the Indigenous peoples of this place we now call Canada and honor the many territorial keepers of the lands on which we work. And so for myself, I'm personally working from home today, and so I'm calling in from the traditional, ancestral, and unceded territories of the Coquitlam First Nation. And normally when I do webinars, I do like to try and see if I can learn something new about the Indigenous peoples in Canada as a part of my continuous commitment to learning and truth and reconciliation. And so with the topic being extreme heat, I wanted to look into some of the resources that are available from Indigenous perspectives on climate change and heat. So I'd like to share with you two resources that I found. So the first is the Indigenous Climate Hub, and this is a unique online community which is pan-Canadian, and it features Indigenous climate change leaders that have come together to share their stories and climate change adaptation experiences. And so I'll ask my colleague Wingsy if she can share the link to this hub in the chat. And on the hub, you can find things like blog posts, podcasts, resources, they have programs, and lots of really interesting information. And of course, it is all from an Indigenous perspective on climate change. And then the second resource that I wanted to share that I found was from the Aboriginal Housing Management Association. And so they actually did a report that was released in 2023 on the impacts of the heat dome, specifically on Indigenous households. And so this report is called Lived Experience and Stories of Extreme Heat Among Indigenous Households in BC. And I'll ask my colleague Wingsy if she can share that in the chat as well. And so I'd encourage you to read this report. It's got some very interesting stories, of course, to share, and then also recommendations regarding how to deal with extreme heat. So obviously very relevant to the webinar that we're having today. So I'd encourage you to check out those two resources in the chat if you're interested in learning more. And then before we begin the webinar presentation, I'm just going to give a few quick housekeeping instructions. So during the webinar, everyone will be muted, but please feel free to introduce yourself in the chat box if you'd like. So you can put in your name, your pronouns, organization, or lands that you're calling from, whatever you feel comfortable. If you would like to, you can also turn on the automatic closed captioning feature using the CC button in the toolbar. These are automatic captions, so they might not be 100% accurate, but of course, if this will be useful for you, feel free to turn it on. There is going to be a question period at the end of this webinar, but feel free throughout the webinar to put in any questions that you have in the Q&A box. And as always, the webinar is going to be recorded and it will be posted on Healthy Aging Core, and the slides will also be made available afterwards. And so now I'd like to introduce our presenter for the webinar. So our presenter is Dr. Victoria Michalowski. She is a postdoctoral fellow with the SFU Lifelong Health and Wellbeing Lab, and you can see their email address on the slide. She has a PhD in health psychology from the University of British Columbia, and her research background is in aging, health behaviors, and coping with stress. Victoria is currently working with the COPE project at SFU, which she'll tell you a little bit about in her presentation. and that aims to enhance heat preparedness in seniors. So I will turn it over then to Victoria, and we're looking forward to your presentation. I'll just stop my slide share, and then my colleague Wingsy will bring up your slides so you can begin the presentation.
All right, thanks so much for the warm welcome, Laura. I'm really happy to be here today. It's really nice timing as we're into Seniors Week, of course, and it's also getting into the first weeks of hot weather this year. So we've already had a few hot days, and it's very timely, I think, to think about how to prepare for the rest of summer. So I am here representing the Lifelong Health and Wellbeing Lab at SFU. My goal today is to share some emerging research with you about how those in the 60s and beyond can prepare for and cope with increasingly hot summers we've been having in BC, especially. So the first part of my webinar will be more about what individuals can do for themselves. And the second part is more about best practices for those who would like to support seniors in preparing for hot weather. So I'm always curious to go beyond the research and hear about your real life experiences and challenges, things that work well. So would love to hear from anyone here in the audience today. I'd also like to briefly share some information about a study we're preparing to run this summer, as Laura briefly already alluded to. So we're actively looking for people age 60 plus to participate. So if you or someone you might know might be interested in contributing to research, then please send them my way. So I'll get started with my first slide. So are the summers really getting hotter? I think that some of us have anecdotally experienced this ourselves, but the data also suggests yes. So the summer temperatures in BC, but also around the world, are rising, and this can take the form of heat waves and heat domes, otherwise known as extreme heat events. So record-breaking temperatures are becoming more common, more severe, longer lasting, and in fact, we're up to about 86 days per year on average of days that pose heat-related health risks for people. So the 2021 heat dome we had in BC was a real wake-up call for our province when we experienced unprecedented extreme heat. And a heat dome occurs when there is extremely hot temperatures and high humidity trapped under a dome of high atmospheric pressure over several days. The province subsequently released a report showing that the most dangerously hot conditions were actually indoors, where there was no air conditioning or fans, and that those aged 70 years or older were among the most vulnerable to heat-related illness during that period. So as researchers, we see this data, and our goal is to generate evidence-based knowledge that can properly support and protect people from future heat-related events. So next slide. So who's at risk? Geographically, places like Vancouver or London, England are vulnerable to the negative effects of extreme heat because we just don't have as much experience with heat compared to other places that historically have had higher temperatures. So our climate is historically moderate. We haven't had to build our cities or our homes or our public support systems in a way where we have to have extreme heat in mind. Now that the summers are getting hotter, though, we are beginning to think about how to adapt. So for the next slide, thinking about age, based on the data coming out of the 2021 heat dome, but also around the world, we know that certain groups are more vulnerable to the negative effects of heat than others. So those age 65 plus have been identified as disproportionately vulnerable compared to others. There's actually been a 54% increase in heat-related deaths in that age group over the past 2 decades. But age alone does not mean risk. So age is ultimately a number, and everybody ages in different ways. And some people develop more risk factors that make them more vulnerable, and others have things in their lives that make them more resilient. So on the next slide. The risk factors that come with older age. So thinking about what is it about aging that does make one more vulnerable to heat. Physiologically, there's age-related declines in thermoregulation. So that means with age, we tend to actually sweat less and redirect less blood to the skin in response to heat. And these are the things that actually help us keep cool. So older age is also associated with higher rates of chronic conditions and medications, which in turn impact thermoregulation or restricts fluid intake, which can make it hard to stay hydrated in the heat. Mobility limitations can also make it difficult to access cooler spaces. So for example, it might be really difficult to climb up and down a flight of stairs in a basement level if you have that in your home. Many retired individuals also have fixed pensions or limited financial resources, which can make it really difficult to adapt to the heat with upgrades in your home, such as air conditioning or high quality home insulation. And unfortunately, with age, people can also be more vulnerable to social isolation, which limits their capacity to reach out to community support or emergency preparedness systems. So we have to recognize that aging doesn't look the same for everyone, and age alone is not necessarily a risk factor, but there are these risk factors that can come with age, and it's important to find ways to support those who are more vulnerable. Next slide. So how does the body handle heat? This is a bit of more of a physiology lesson. So a healthy body temperature lies within a fairly narrow range of about 36.5 to 37 degrees Celsius. And the body has different ways to maintain this narrow range. So when it's really hot, the body cools itself down in two ways. One is by redirecting blood flow to the skin's surface. And the trade-off of this is that the heart has to pump faster and harder to accomplish that. And the other way the body cools itself down is by sweating. But if the body sweats too much, then this can lead to dehydration, which is why it's really important to hydrate when it's hot. So when this happens, if the body's capacity is overstretched by trying to make these cooling systems happen for the body, then that's when heat illness can result. And the next slide. So heat illness itself is a blanket term that covers, oh, sorry, there's a bit of a typo in the slide, but what I'm trying to say in that sentence is heat illness is a blanket term. It covers all the illnesses that can result from body temperature becoming too much. So heat illnesses include things like heat edema, heat cramps, heat rash, heat exhaustion, heat stroke. These conditions range in seriousness all the way from mild discomfort to injury or death. We are academic researchers, so I'm not a medical professional, but I can share guidelines of what these things are. So guidelines from Health Canada suggest that if you experience symptoms of heat-related illness, then it's important to seek help right away. So during extreme heat, it's helpful to pay attention to the following symptoms highlighted here. So one of them is to pay attention to how your muscles feel. So muscle spasms, hardness, or soreness, these are all common symptoms of heat illness. Another is changes in heart rate, whether that means your heart is beating too fast or too slow. Another is changes in your skin. So if your skin is very pale or if you have very red skin, then that can be a symptom of heat illness. And monitoring how much you're sweating can be helpful, as sweating too much is a symptom of heat illness, but so is not sweating at all. So if you've been sweating a lot and then you stop, then that can also indicate that something's wrong. Headaches are a common symptom, especially after being in the sun. Difficulty breathing is also connected to heat illness, and other symptoms include feeling just unwell in your body or mind. So that can mean feeling confused, restless, anxious. It can also mean feeling weak or dizzy or fatigued or nauseous. And recognizing and being aware of these symptoms in yourself or someone else, helping someone else recognize this on hot days can be potentially life-saving. Next slide. So there's several different ways that you yourself or you can help others be protected from the heat. Everyone has different ways to cope with heat depending on their situation, and there's no just one correct way. The most heat protective strategies do have some downsides, and many of them have benefits, so it just depends on your own situation. The most talked about strategy is probably air conditioning, and for good reason. So it's an extremely effective way to cool down indoor temperatures. But especially in historically mild climates like what we have in BC and the Lower Mainland, not everybody has air conditioning in their homes, and especially in some older apartment buildings. So even if you do have air conditioning, mm, the electricity cost can be pretty hard on budgets. So constantly running air conditioning has some downsides. It can also strain power grids or contribute to greenhouse emissions. So air conditioning it's not without its downsides, but undoubtedly helpful for many people who need it. Um, Most people are able to use electric fans, but fans do provide limited cooling benefits, especially in very hot and humid conditions. So opening windows at night and the morning is another very popular one, but it's important to do that strategically. So it's always helpful to open them early in the morning and then make sure everything's closed up when it's the hottest times of day. Closing blinds is the same, so it's best to close blinds when sun is the highest. Keep them open in the early morning. Changing what you eat when you hot can be helpful. So opting for water-rich foods like fruits and veggies can is a great way to stay hydrated. And if accessible, cooling centers and air-conditioned public spaces are very helpful. They're great for providing some respite from the heat for a few hours in the day at least. The main downside of those is that they offer temporary relief and are not always available for every community. So that's kind of the main downside of them is that they're just kind of limited. It is recommended that physical activity should be minimized on hot days or kept to the cooler times of day, like early morning or indoor air-conditioned spaces. And it's an important recommendation to follow, but it's hard for people who have routines like walks with their neighbors, and then it can be hard to get back into those routines after the heat subsides. Another one is increasing water intake. So that's very key for combating dehydration as we do sweat more when it's hot, obviously. And this is also a tough one because dehydration can occur even if you don't feel thirsty. Next slide. And then avoiding alcohol and caffeine is important because alcohol and caffeine can actually further dehydrate you. So water is always better on hot days, even though summertime is when people would sometimes prefer to have a cold beer or a nice tea. These things don't actually end up hydrating you as effectively as water. And then something that research is finding effective at the community level is having family members, neighbors, or friends check in on each other on hot days. Some of the symptoms of heat-related illness that I mentioned earlier, they're actually a little bit difficult to recognize in yourself. It's hard to know if you're confused sometimes, or if you have pale skin, you might not notice that unless you're looking in a mirror or something. And these symptoms can also be missed if you're only connecting by phone. So there's a solid body of research now showing that there are several heat protective strategies that almost anyone can use and are actually really sustainable. So just having access to cool tap water can be really helpful. So for example, research shows that intermittently self-dousing with water, even water that's up to 20 degrees Celsius, so it doesn't have to be super cold, to large areas of your skin can be effective for reducing cardiovascular strain and reducing dehydration by up to 65%. And the nice thing about this is that it works well in both hot and dry and hot and humid conditions. And then foot immersion in water, so again, up to about that 20 degrees Celsius zone, is really effective for cooling the whole body down, even though only your feet are submerged, and reducing dehydration in hot and humid conditions. So sometimes you might see people parking their beach chairs or lawn chairs into a river or a lake, and that actually is very helpful for cooling your whole body down. And the nice thing about it is that it's fairly accessible, even if you're in an apartment or somewhere like that. If you just have tap water up to 20 degrees, an easy thing that most people can do. If you're only immersing your hands and forearms, then cooler water is usually required, more in the ballpark of 10 degrees Celsius to actually effectively cool the core body temperature down. And a nice aspect of self-dousing or immersion is that even with 20-degree water that doesn't even normally require electricity and can be really effective, even like in the case of a blackout or something like that. And lastly, kind of an obvious tip is to avoid using the stove or oven on hot days just to keep the indoor temperatures down, which is the temperatures that can get really dangerous. Next slide. So few seniors actually seem to use heat protective strategies is what the research is showing. So as a researcher who aims to better understand coping with heat, we kind of take a special interest in what works and what doesn't work for people. So this is because despite vulnerability, people age 60 plus seem to struggle with uptaking heat protective strategies in that not many seem to be using them. Studies have shown that only about 8% use cooling centers, only about 8 to 16% will use a cool cloth for cooling down or a wet cloth. Even among those who are especially vulnerable, such as older people with chronic conditions who even have air conditioning in their homes and should be using it, only about 2/3 of them actually do. Many people report opening windows and using fans, which, as we already discussed, is helpful, but only when it's strategically used and in conditions that are not extremely hot and humid. So there seems to be a bit of a gap between the recommendations to use heat protective behaviors and what seniors are actually doing. Next slide. So how can we fill this gap? And this is more for the, people who work with seniors in the room, so service providers, what might work. So the gap between recommendations and reality is not really unique to health protective behaviors. So for example, many people struggle with health behaviors like exercising or eating veggies. And we have a large body of research about what works for health behavior change in general. And that might be informative when thinking about what to do to help people, encourage them to take up the heat protective behavior. So we can generally split these interventions into two broad categories, those that target individuals or things people can do for themselves. So that's a lot of what I just went over and talked about. And then the social structural interventions, which are things that others can do to help people enact that behavior. So I'll try to keep this brief, but I thought it might be helpful to highlight a few of these. On the individual side, a popular approach is knowledge-based interventions. So this includes providing educational workshops, resource booklets, and very much what I'm doing with all of you today is a good example of that. And let's see, kind of with the goal of promoting health behavior change. Another one is emotions, which includes things like emotional appeals to sensitize the audience to risks. So for instance, those pictures of lung disease that are on smoking cartons aim to do that. They appeal to people's emotions, right? And then habits are interventions that aim to make the behavior automatically part of daily life routines. So this is more common when you're trying to target a habitual behavior like hand washing or taking the stairs. And then on the social structural side, over to the right, support is one that includes any help provided to an individual to encourage a behavior. So this can include bringing in family members or important social others. Another one is monitors and reminders, which usually involve leveraging technology and sending reminders or messages to promote a behavior based on some metrics. So, for example, my watch tells me when it's time to stand up if I've been sitting for more than 50 minutes straight. Um, fitness trackers in this realm have gained a lot of popularity actually in the past decade or so. And then the last one I'll highlight from this list is access, which is when material or logistic resources are provided to facilitate a behavior. So this is one that's actually gained a lot of traction with heat behavior uptake through cooling center availability, or some of you might be aware that BC Hydro has a program where they actually provide free air conditioners to certain populations who qualify for it. Next slide. So for health behaviors in general, a recent paper that was published last year was actually able to compare all of these different types of interventions across many different health behaviors to get a sense of the relative effectiveness of each type. So the most effective interventions in this study had what we call medium to large effects. So anything in the medium to large effects zone in the bottom of the circle here is highlighted on the rectangle on the left. So they found that the most effective interventions on the individual side were actually habits. So those that target habit building, making the behavior automatic to the point where you don't even think about it anymore, are the most effective. But most of the other effective interventions actually came from the social structural side. So these include access, which was identified as by far the most effective, had the largest effects. Included making, so this includes things like making materials or resources needed to enact a behavior available. So you might know you should use air conditioning, but if you don't have it, then you can't do that, right? And then after that, interventions that include material incentive and descriptive norms were found to be effective ways to change behavior as well. So material incentives include things like providing financial or non-financial incentives for enacting a behavior. So this could be things like paying people to get a vaccine or offering tax breaks for having a heat pump in your home, things like that. And then descriptive norms are interventions that target perceptions of what individuals think other people do. So this could include things like putting up signs in the hallway that, oh, most people are taking the stairs, you should too, things like that. And I will quickly note that knowledge is in the light blue zone at the top of this circle, indicating that simply sharing information with people is actually among the least effective interventions. So what I'm doing today, just sharing information alone, is often not enough to change people's behavior, right? It's important, but it's also not the only thing that that could be done, right? And I think that makes sense because we know that recommendations and guidelines are quite well developed for many health behaviors, such as how to protect yourself from the heat, but also, how active people should be, how much fruits and veggies they should eat. But we know that that doesn't always translate into people actually doing those behaviors. So and it's also important to note that these findings are what works for health behaviors in general, but we can take hints from this research about what might work for promoting health protective behaviors, heat protective behaviors as well. Next slide. We do have some initial research on the effectiveness of interventions targeting heat protective behaviors specifically, so in the realm of heat. And these are generally of two types. So there's been educational interventions and then heat action plans. So I'll start with the educational. Research shows that these types of interventions do actually seem to be effective for increasing risk awareness in older adults, which is great because the first step to taking action is to actually recognize that you're at risk and that you're at risk in the first place and something needs to happen. This is a very individual-based intervention and just shows moderate effectiveness for increasing heat behaviors. So again, just because you know you should do something, it doesn't mean that you actually have an increased ability to do it. Next slide. Heat action plans have been developed by many places, like BC, where extreme heat is unprecedentedly becoming more common. And they've actually been found to be quite effective in reducing heat-related illness. They're often very multifactorial, meaning that they throw together a lot of different types of interventions to try to create some kind of results. And so they often include the following components. So they might identify and monitor people who are at risk. They usually include some sort of heat health warning system. So they have some kind of system in place to alert people. They try to improve the healthcare capacity and coordination to meet demand. So to make sure if people are becoming ill from the heat, there are people who can take care of them. They also they have informational campaigns, so, offering knowledge and education about the risks and what kinds of things people can do. They often provide cooling centers, they build community networks, and establish heat helplines, so someone you can call if you have concerns or feel ill or have questions. Many of the features of the previous health behavior interventions I just went over are reflected in this list, which is really nice to see because we know that many of these approaches do generally work for promoting health behaviors. And in combination, you throw a lot and some of it kind of gets results, right? So it's great. Next slide. So here's an applied example of a heat action plan called Connect and Prepare that was actually developed and piloted and has been running in BC since about 2018, I think. And I think they've slowly been expanding through the Lower Mainland. I might be wrong, but I think they started in Victoria and Vancouver and have since been expanding. So what they do is they build community resilience through social connectedness and emergency preparedness. So they kind of combine those two. They have a trained workshop facilitator lead a group of neighbors through a series of modules where they try to identify what do you already have, what do you need, what are the priorities, and what ways can we take and sustain action in your local neighborhood. So they're often delivered in person for residents of multi-unit apartment buildings or neighbors in the same block. So the strategy or their approach specifically engages vulnerable and socially isolated seniors through facilitated social connection and reaching people where they live. So it's a strength-based approach in that it emphasizes social connection as a part of emergency preparedness, and it can be flexible to the needs of each community. And it was noted actually in one of their reports that residents with the most challenges were often most excited and the most engaged to be in the process of collectively preparing for emergencies with their neighbors. And they created a resource that I linked on the bottom there for anyone who's interested, but it's called the 5 Simple Neighborly Actions to Prepare Together for Extreme Heat. And it's just things that neighbors can do together. So getting to know your neighbors, knowing who lives around you, setting up neighbor communication systems, ways to find a buddy and be a buddy to someone else who lives near you, ways to prepare to stay cool, and just some other resources. So it's been a successful program, and it's kind of a neat way to build social connection and build on things that already exist in your immediate community while emphasizing the heat preparedness aspect as well. Next slide. So taken together, we have some initial empirical evidence for what works pretty well for supporting vulnerable people to take action to protect themselves and, so what people can do to help. The most effective interventions for heat so far that's been identified in the research is heat action plans, and the most effective features of them include the following. So making climate-controlled spaces not only available, but also welcoming, so offering fun activities or points of connection for anyone who drops by. Focusing efforts on those who need it the most, so the most vulnerable. Engaging community residents to build trust and target also specific needs within a community. Reaching people where they are, so that's kind of what Connect and Prepare did really well, is going into where people live and their neighbors and building on that social capital that exists. And which leads me to the last one, which is building on what communities already have. And next slide. So I just included a few links here for other helpful resources that people might find, things that people might find helpful. So the City of Vancouver has this cooling center map that actually points out on a map where people can go to find cool spots. There's the BC Hydro Free Air Conditioner Program, which I think they had, I don't know if they started it last year or the year before, but they're continuing it this year. And then a few links that are quite nice for how to check in and support others during hot weather. So these are more targeted towards service providers, but it's nice to kind of know just some brief training for how you can support these people. And then Vancouver Coastal Health has a resource page for extreme heat that's very comprehensive and has lots of great resources. So I definitely encourage anyone who's interested to check that out. And then I'm sure these links can be posted in the chat. I just saw a brief comment there. Yeah. Okay, and then that brings me to my last slides. So more research is needed. Our research team is currently looking for research participants. If you or someone you might know is interested in contributing, then we're inviting people age 60 plus residing across the Lower Mainland to participate in what we call the COPE study. So, in a nutshell, we're interested in hearing from people age 60 plus about their experiences with extreme heat. We use mixed methods to understand the challenges people are facing and also the strategies that are working well for them. Participants will be asked to join us for in-person meetings and also complete daily life assessments. And so what we do is we lend people study equipment to take home, including a smartphone to complete surveys on 3 times a day, a smartwatch that tracks things like skin temperature and heart rate, and a small temperature and a small sensor that tracks ambient temperature and humidity. Participants are reimbursed $150 in the form of a gift card to a vendor of their choice or a donation to a charity of their choice. And we also give people health feedback letters. So we give a detailed report of each person's individual health data from the study. So what their average heart rate was, their skin temperature, the indoor temperatures that we track, things like that. And we also hand out a resource booklet at the end with helpful tips for coping with heat. And then last slide. So feel free to share with others or reach out to us at the SFU Lifelong Health and Wellbeing Lab. I'm happy to connect with any of you today. If you'd like to follow up with further thoughts or questions, then you can always contact me through this email or phone number as well. That's everything for today. Thanks so much for taking the time to join this webinar, and I'd love to open up the room for questions or comments.
All right, thank you very much for that presentation, Victoria. I can see from the chat that your resources have been very appreciated, and I've shared them in the chat, but we'll also send out after the webinar the recording and the slides and the links to everything that you've shared. We do have a comment in the chat that I was wondering if you might want to reflect on. So somebody had noted that they're a former healthcare worker, and she noted that or they noted as seniors age, their ability to actually feel temperature accurately due to the deadening of nerve endings decreases significantly. So an elder may not actually feel hot despite their home or person being at a dangerous temperature. And I'm wondering if you have any reflections on that in terms of interventions.
Yeah, I mean, the first thought is that's definitely reflected in the research that there's the decreased, I can't remember what the formal term is, an interoception, I think it is, where there's a disconnect between feeling, what the actual temperature is around you and that you're actually starting to feel hot from it. That's true that seniors do have a harder time with that often with age. I mean, in terms of interventions, I think that's where it really makes sense to, connect with people in person, especially. And, it's one thing to call someone and, ask, how are you doing? And someone will say, I'm great. But then you walk into their apartment and you're like, it's roasting in here. What do you mean you're great? Right. So, I think, building, that's partially why I highlighted the Connect and Prepare program, because I think that was an intervention that did that particularly well. And making sure that those in-person connections, especially for those who might be more isolated and not having those daily visits or maybe not even leaving their apartments every day, right? They might be missing that. So I think that's really key for especially helping those who are most vulnerable in the heat.
Yeah, thank you for that response. And if folks have any questions, feel free to put them in the chat. I'll ask one of my own now.
Sure.
So I was interested by the fact that in your presentation, many older people actually do have access to air conditioners, or at least there's a notable proportion, but there's also a notable proportion that even though they have one, they're for whatever reason not using that. And I was wondering if there's any additional insights about why people might have an air conditioner but not use it. Is it related to the cost to run it, or are there other reasons?
Yeah, for sure. So that specific study came out of Montreal. So there, I think they have a little bit more experience with heat. I know Eastern Canada has a little bit more than we do with the higher humidity, especially during the summers. But I know they asked in that study and in other studies as well. And I know leading reasons for it are things like sometimes people don't like to feel cold. They prefer to feel a little bit warm rather than too cold. For some people, the noise is really annoying. They don't like to hear the constant humming. Air conditioners are noisy. For some people, there's a belief that having cool air blown on them will make their health conditions worse. So these were people who had specifically COPD, I think lung diseases specifically. So there was that concern that was noted. For many, it is the cost. It's not cheap to run an air conditioner, especially I think especially in places where electricity costs a lot. Um, I think those were the main ones. I know, and I mean, I think a lot of those are pretty relatable. I know for myself, I have a hard time sleeping with an air conditioner. I mean, I think it depends what kind of air conditioner you have, because if it's central, then it's a little bit less noisy, a little bit less about cool air blowing on you and more about just your climate and the ambient temperature in the room being cool, versus cool air like directly blowing on you from like a portable air conditioner or something in the room, right? Um, so there's lots of reasons why people might not use it, but it's important, especially because we know the indoor temperatures can be the ones that are the most dangerous and the hardest to detect if you're by yourself that you're in danger, thinking back to our previous comment, right? So
Yeah, thank you for sharing all that additional information and reflecting on that. I myself sometimes, when I have the air conditioner on, I feel like it makes my nose a little bit drippy. So I guess there are different downsides that you might have that might cause people not to use them.
yeah, yeah, exactly. Yeah, not everybody finds it that comfortable, right? So yeah.
Yeah, great. And then I don't see any questions yet in the chat, but I'll give another moment in case anybody wants to ask anything else. But one last question that I do have is, so I'd be interested to know, so you've shared a lot of great strategies, both for from the individual perspective in terms of trying to change an individual's behavior, but then also for the more social structural interventions like access to um, air conditioners or support and other things like that. And so I'm wondering, as most of the people in the audience are community-based senior services, so they might be have more opportunity to intervene on that individual level rather than the social structural, though of course they can do home visits and things like that. I'm wondering if you could just speak a little bit more about for the individual level. You did say that it wasn't as effective, some of those interventions, but more about, I guess, effective ways for providing information or increasing awareness about people's risk.
I mean, I think they kind of interact. So a lot of the individual ones, I think on their own in isolation are a little bit less effective. But I think, especially if you're someone who does take care of seniors or is someone who's aiming to help, then you're already part of the social structural side, right? So you can do things like, like checking in on someone that is a social structural intervention, right? So it's something where you're not simply giving someone a pamphlet and saying, here, this is what you can do to protect yourself, right? If you're combining that with something like a check-in or, saying, hey, there's this cooling center here, like it's accessible, it's in your building or something, or it's just down the street, then that's helpful too. Um, I think things like maybe even what was a couple of the other ones that were useful? I mean, a lot of these aren't tested, but just kind of thinking aloud. Um, you know, uh, like just being someone there for support, saying, I'm here to help you. What can I do to help? That's helpful. Or being someone that a senior already trusts, the information coming from you, that helps a lot as well. Or even things like, just providing, like, I think providing access can come in a lot of different forms. Maybe seniors aren't aware of the BC Hydro program that they qualify, or just even providing access to like something as simple as a little water basin to immerse your feet in and say like, hey, this helps you cool down if it's getting hot. So I think there's, you even if you're not on, the policy making side of things, but you're just on the ground and working with seniors, I think there's a lot of ways that that you do have a lot of power to check in and make sure that people are able to not only it's not just on the onus of the senior to help themselves, but it's something you can do to help as well, for sure. Yeah.
Yeah, thank you very much for those reflections about how to kind of marry that individual intervention with actually providing access or support for the social structure ones. So I think that's really great, those reflections.
Thanks. And I think that was also highlighted in the heat action plans I mentioned, right? Where they threw a lot of those things together. And I think in combination, they actually can be more effective than just isolating it into those specific categories, right? So I think there's a lot of ways, like you said, that they can kind of marry together and work together. And I think the combination is almost more effective than just telling someone like, you should stay cool, but giving them some tools and resources to do that can help too.
Hmm. Yeah, and the information that you shared about the heat action plans, that was really interesting to me because I hadn't been aware that
Mhm.
those were being implemented at the kind of neighborhood and community level. So that's a great resource as well.
Yeah. No,
All
that's
right,
great.
great. Well, in that case, if there aren't any questions from the audience, I think we can conclude the webinar. So I just want to really thank you for your time and for sharing all this information. I feel like I've learned a lot, and then I've also really appreciated the very practical resources that you've shared, as well as the strategies for supporting older people and encouraging protective behaviors during extreme heat. So I'm sure this will be really useful for folks as we move forward. With the summer, of course.
Yeah, of course. I'm so happy to be here. Thanks so much for having me.
Yeah, thank you very much. We'll send out the recording and the slides and also all the links, of course, after the webinar. And I hope everyone has a really wonderful rest of your seniors week.
Yeah.
Right. Take care, everyone.
Bye.